So healthcare professional is defined very broadly within the statute and includes folks like social workers or hospital intake staff. And basically what it says is it gives the healthcare professionals an extreme amount of discretion when it comes to whether or not they choose to report women who test positive for controlled substances. The law is very clear in that they are not required to report women to Child Protective Services. And the options that they have are to work with the women, and if and when they are ready to seek treatment, or whether treatment is really the best option for these women, is a conversation that women should have between themselves and their doctors. And the law gives healthcare professionals the latitude to seek different options, as opposed to immediately reporting a woman to Child Protective Services when a positive drug test is found. Providers just need to make sure that they have a solid policy in place when it comes to how they are going to care and address these issues when it comes to expectant mothers who have substance abuse problems or test positive for a controlled substance for any reason. And there's a lot of misconceptions around that the law, especially the 1999 cocaine mom law, required health professionals to report when an expectant mother tests positive for controlled substance. That is definitively not the case. The statute explicitly says health professionals may report, but they are not required to. Another misconception, I think, that providers across the state, big or small, need to think about is I think people are confused as to whether or not consent is required for drug screening of expectant mothers, even when the doctor suspects that there might be some substance abuse use. And again, the statute, when it comes to expectant mothers, is very clear that consent is required before you can screen an expectant mother for drug use. The current drugs covered by the Wisconsin statutes are controlled substances, and that just means Schedule 1 and 2 drugs as defined by the FDA and DEA, as well as controlled substance analogs, which are essentially drugs that are substantively equivalent to those Schedule 1 and 2 drugs. If a physician decides to perform drug screening on an expectant mother, after the mother's consent, of course, the law also requires physicians to create an explanation, a written explanation for the mother, and the explanation must include the date the test was performed and the test results. The law also requires that physicians explain to the mother whether or not they plan to refer the results of that test to Child Protective Services. The law is a bit more stringent when it comes to drug screening for infants, and we know that the law requires health professionals to report positive drug tests to Child Protective Services. The healthcare professional has the discretion to decide whether or not there is reason to believe the infant is being exposed to controlled substances, and if they believe that the child is at risk for being exposed, they do have the latitude to require a drug screening of that infant. If the drug screening is positive, the law requires the healthcare professional to report that positive testing to Child Protective Services. The law also requires that the healthcare professional explain in writing to the mother or the guardian of the infant what's going on, so that there was a positive drug test and that test result must be reported to Child Protective Services. But even though there is mandatory reporting for infants, I think it's important to reiterate that providers always have the option in cooperating with the mother and the infant and ensuring that they're working as a team and that they're working with the mother's other providers, for example. Many times you see a mother who's impacted by opioids in particular, and she has an addiction specialist provider, and she has an OBGYN provider, and they're not necessarily always communicating very well. And that puts the patient in the middle. One of the things that WAPC has been working on for the last few years through their regional forum series and through their Blueprint for Change when it comes to opioid effects for mothers and children is to get ADOA providers and OBGYNs and other perinatal providers into the same room and talking about these issues together and deciding what the true standard of care should be for mothers and children impacted by opioids. Well, we know that the law gives healthcare professionals tremendous latitude in whether or not they report to Child Protective Services upon a positive drug test from an expectant mother. And we also know that leading medical organizations like ACOG recommend that you work with patients who are dealing with substance abuse issues, and that the literature shows that punitive measures and forcing women into treatment does not result in better health outcomes for women or babies. We've seen how the opioid epidemic has spread throughout the nation, and it's really at emergency levels. I think most folks would agree. And it's one thing that the Wisconsin Association for Perinatal Care, WAPC, has done is they have been working on the issue of how opioids affect mothers and children for years. And they are apt to bring providers together to advocate on behalf of patients who are impacted by this population. And that, because they work with that population on a daily basis, they know the science behind it, they know that health outcomes are better when you work with patients and when they are not forced into treatment. And that's something that's happening right now in Wisconsin through this cocaine moms law. And one of the things that providers can do is, because this is all coming to a head through the Tamara Loescher case, is that they can advocate on behalf of patients by writing an amicus brief to the courts explaining why the cocaine moms law isn't the best avenue for working with and treating patients impacted by opioids. I really appreciate the forward thinking that has come out of these regional forums in the past and the action that I've seen taken by providers through the Association for Perinatal Care, and that we are on the cusp of change. And it truly just requires those folks who know what's going on and those folks who care to stand up and state their opinion and state the facts as they know them. And I really think that people are listening, and now is the time to speak out. If people have questions about this issue, I would really recommend that they reach out to the Wisconsin Association of Perinatal Care, which actually has a blueprint for dealing with the effects of opioid on mothers and children. They're doing some great work across the state and have some excellent resources available to providers. I would also say that Department of Children and Families has a great policy you can find online with a quick search that can orient you towards the law and give you a good synopsis of what the law is. And finally, I would say that it's always a good idea to reach out to your own counsel, whether you're working at a larger hospital and have an inside counsel, or whether you have an outside counsel you refer to for these types of questions.